Dr. Uma is going to present a case of homonymous hemi post-COVID infection.
Good afternoon, everyone. I would like to present a case report of left homonymous hemianopia following COVID-19 infection. As we all know, COVID-19 is caused by SARS-CoV-2 virus, and it led to a worldwide pandemic. We all have faced the consequences of the COVID-19 infection. The manifestations of the disease are greatly variable, from mild flu to life-threatening condition, and ophthalmological manifestations are reported in approximately 2 to 32% cases, whereas CNS involvement is reported up to 0.1 to 25%. That is the wide percentage is reported in various papers. The symptoms would include most commonly of anosmia, ageusia and headache, and less commonly stroke, impaired consciousness, seizures, encephalopathy, venous sinus thrombosis, etc. Result of the viral neuroinvasion can occur from transsynaptic route, vascular endothelium, or leukocyte migration. Moving forward to the history, a 57-year-old female patient presented to our OPD with chief complaint of left-sided defective vision since 6 months, and she had a past history of COVID-19 infection, which was 6.5 months back, and she developed a left-sided stroke 6 months back. That is after 15 days from contracting the COVID-19 infection. One episode of seizures was following COVID-19 infection 5 months afterwards. On examination, the patient was general examination was all normal, except the patient has left-sided hemiparesis. And visual acuity, to our surprise, as patient complained of left-sided DOV, but on examination, the visual acuity was better in left eye and worse in right eye. Anterior segment examination was normal, except pupil had RAPD in left eye, and ocular movements were slightly restricted, abduction in both eyes. Visual field charting was done on Humphrey Visual Field Analyzer using 30-2 program. Here is the Humphrey report of the patient showing left-sided homonymous hemianopia and severely depressed visual fields in the right eye. So the MRI scan, the patient already had this MRI scan with her, as she also developed a stroke. So the MRI had this large subacute to chronic infarct involving right frontoparietotemporal occipital lobes, including basal ganglia with cortical laminar necrosis, and there was no flow-related enhancement noted on the right middle cerebral artery on angiography. These are the blood reports, which are essentially normal in the patient. The management was symptomatic from our side, so we prescribed 30 PD base out prism for Fresnel prisms for symptomatic improvement, and patient received the anti-hyperlipidemic plus anticoagulant, antihypertensives, and diuretics from the neurophysician. So, okay, we can skip this.
Conclude.
So, thank you.
Conclusion, you can conclude.
You can conclude.
You can tell
slide.
us.
Yeah.
Yes, ma'am. So all the reviewed studies demonstrate that neurological manifestations are broad and heterogeneous, suggesting different underlying pathological processes and pathways. Even though neurological manifestations represent a very small portion of COVID-19 manifestations, these can be life-threatening and side-threatening, leaving the individual with lifetime of serious impairment. Identification of such manifestations is crucial in early treatment and recovery. So, thank you.
Okay, thank you. What was the relation of COVID with your paper?
Ma'am, this patient had COVID-19. She contracted this in the first wave in March 2020, and in April itself she developed this stroke and left-sided defective vision. But the patient did not present to us at the same time because she was admitted elsewhere. for the stroke and all. And after recovering, actually she was recovering from the stroke when she presented to us. Even she was able to walk also. She came in walking, not on wheelchair. She came in walking to us, but
So
she,
you want to say that the COVID caused the stroke?
yes, ma'am. Yes.
Okay.
There have been vascular episodes post vaccination also. So
I was about
have you did you find out whether the patient was vaccinated or
Sir, the patient was not vaccinated. It was very early in the first wave itself.
and coagulation profile of the patient, the parameters that we usually see, did not mention
Like
all?
any other systemic illness the patient had?
No, ma'am. The patient did not have any other systemic illnesses also. And sir, lipid profile was normal that I have mentioned in the case
D-dimer,
report.
you
No,
don't-
the D-dimer
those are
and
the
all was
important
not
tests
on.
you look at when you want to talk
And
about.
literature, what does the literature say? Any other story? This is anecdotal. I mean, yours is the first case, or is there anything else has been
Ma'am,
reported?
I have found one more case of the similar homonymous hemi anopia in the
Did
literature.
you mention that in your
previous-
paper?
Sorry?
If you had mentioned that in your paper, we would have corroborated your findings rather than it being an anecdotal association kind of thing. There is no causative, what we are trying to say is there's no causative thing between COVID and the homonymous anomia. You have not shown that.
Yes,
Any way
that's
to
the
prove
drawback
that,
of my
yes.
case.
Thank you.